All right, welcome to the PTL Enhancement Course. This is part one of our two-part courses. All right, this is Robert Pankov, Health Promotion, 325th OMRS, Tyndall Air Force Base. All right, in this class, we're basically going to overview everything for a current physical training leader to help reduce the risk of training, injury prevention tactics, universal precautions, talk about heat stress, sickle cell, exercise warning signs, training programs, and of course at-risk groups for physical training. So basically leading safe, effective physical training sessions. This course does not replace any current Air Force instruction to become a physical training leader PTLB course on ADOS. All right, so universal precautions for physical conditioning. So we have about 6 different things to keep in mind as we get airmen ready for their fitness assessment, and that may need to require moderate exertion type level. Acclimatization is key for individuals given that 2 to 4 weeks, coming from different environment conditions, even from altitude issues, reducing their overall maybe time, also their intensity for aerobic conditioning, and moderate their strength training that they've been accomplishing for 5 to 7 days. Allow enough progressional time to gradually increase intensity time, also intensity. We need to adhere to current guidelines for hydration, promote water solely, exercise up to 1 hour, drink water every 3 to 8 ounces, 15 minutes. Prior to, during exercise, avoid any other harmful stimulants or alcohol consumption, energy drinks, and any type of diuretic medication that might be taking over the counter, pre-workout supplements, any weight loss performance enhancing supplements. Again, this can all be referenced on opss.org, Operation Supplement Safety. After completion of a physical training session and or fitness assessment, individuals should be observed, making sure in their passive cool down stage, their participants should be observed for approximately 10 minutes. Any early signs of distress, provide prompt medical attention as needed. Here is from the National Weather Service a heat index, very similar to the cold on a wind chill factor. In the heat, utilizing both temperature and dew points of relative humidity to extrapolate again the heat index number. Exercising, of course, working out in the sun, hot, humid days is going to be the most times to adhere to these guidelines, staying out of the red. As the humidity increases there, the more sweating, loss of electrolytes and fluids, dehydration could occur. Poor physical fitness, lack of experience, of course, is another risk factor to be aware of. The regulation of body temperature, of increase in body fat. Exercise clothing that's more compressed, dark in nature, as we need to be wearing thin layers and lighter colors. Any stimulants, caffeine, energy drinks, and of course alcohol. Current illness and fever, individual not feeling well, prior history of any type of history of passing out or heat exhaustion, heat stroke, and of course, awareness of dietary supplements. In previous years, there has been issues with fitness assessments and testing and some adverse reactions with sickle cell trait, which is an inherent red blood cell condition utilized to be screened at birth and entrance into the Air Force. 2 genes translate to a sickle cell disease, 1 gene, of course, sickle cell trait. It can be benign if recommendations are held by the airmen for hydration and exercise duration, intensity, precautions are followed as needed. Conditions that increase the risk: significant to sudden increased exercise intensity, failure to adhere to new heat environment conditions, poor acclimatization, exercise when ill or dehydrated, and any other types of supplement use from stimulants, pre-workouts, alcohol, drug or alcohol use. Some additional exercise warning signs: abnormal heartbeat, of course, regular pulse, rapid fluttering, decrease pulse during exercise, palpitations in throat, heart beyond normal exercise feeling, discomforts, pain, heavy pressure in the chest before, during, after exercise, abnormal shortness of breath, not just from exercise, sudden pain, numbness in any part of the body, pain, heat, burn in region upper abdomen, dizziness, coordination issues, cold sweats, and of course loss of consciousness. Any issues with temporary loss of speech, blurry vision. So we need to recognize overtraining symptoms, as this can be different for everyone. Excess fatigue without running. So even on these easy run days. So poor recovery. Workout performance starts to decrease, but keep in mind, could be cardiovascular issues signs as well. Poor sleep patterns, sleep issues with quantity and quality of sleep, sleep inertia, the grogginess upon wake up continues on throughout the day. No appetite, stomach aches, apparent weight loss, mood changes, irritability, increased respiratory infections, and stiffness, soreness, tenderness in joints and pains, just that chronic pain, that inflammation that just doesn't want to go away. Some at-risk groups for physical training. So anyone that has any sort of cardiovascular disease symptoms and issues, risk factors such as high blood pressure, joint pain association with arthritis, increase in body fat, overweight or obese, orthopedic concerns, maybe previous sports injuries, joint issues, ligament issues, prior ankle sprains, lower back pain, pregnancy. Keep in mind for pregnancy, Air Force does have a program to kind of screen and provide exercise prescriptions for those that are pregnant. Different contraindications for pregnancy based on recommendations by their OB doctor. Most female airmen in their first trimester can continue on with no limitations with exercise, but following that exercise prescription in the subsequent trimesters. Respiratory issues, disease, asthma. When in doubt, refer member to their physician to provide those limitations as needed. Profiles. Sometimes, unfortunately, the conventional wisdom for airmen on profiles is providing their mindset of limitation of doing nothing. But we want to make sure that members can do what they are able to do. Modify exercise types, modify exercise intensity, duration, as much as possible, so the member still can be belonging to the group and still performing some sort of exercise. As this is documented on the Air Force Form 469, read that profile. Scale it to the member what they're able to do. If no walking grade at 100 yards, walk 100 yards, take a break, walk again. Really encourage the members to exercise the importance of movement without dictating or forcing them to do something they're not comfortable doing. Consider this modification or rehabilitational schedule increment increases in their walk-run progressions. You can always refer them to health promotion, to see their exercise physiologist, to maybe assist a member with modification programs. All right, next we're going to talk about running form. Within the running form, we want to work the mechanics, to work on the economy of running, to be more efficient, spend less energy in their running. How should I run? 3 areas we want to look at: posture, position, and cadence within running. In posture, basically means a body column aligned balance. Our head is forward, level to the body. We look forward, shoulders relaxed, start leaning forward at the ankles, not at the waist. We do not want to compromise their body column. Line position. Feet straight ahead, neutral position. Position of foot strike should be somewhere between the mid forefoot strike initially, and then lastly with the heel kiss, but not engaging the heel first. Do not reach out. Elbows bent 90 degrees, arms close to the body, not crossing over your midline of the body, elbows straight back. Relax, passive as possible at the ankles and wrists, and load underneath your center of mass, lightly. When we strike the ground, we need to strike more proprioceptiveness, which means that ground reaction force make an impact to the ground, sends a signal to the brain, and how hard I should hit the ground perceived from the running surface I am running on. Cadence. Cadence is not pace. Cadence will always stay the same regardless of your pace. Short, quick strides by not reaching out. Somewhere between 170 and 180 steps per minute. We should be at a passive intensity level for most of the time in that 75% of max intensity. And we'll cover that with aerobic-based training in the next few slides. Phases of a running gait. Again, poor running form can also result in inefficiency, less performance, and possibly increased risk of injury. Within these 5 stages of the running gait, preparation is key. Ready to make contact to the ground. Without reaching out, our body is aligned, column. We land, contact to the ground without lifting up the toe. Do not dorsiflex. Keep a neutral foot, forefoot, midfoot hits the ground, and then the heel kiss. The knee is slightly bent. Mid-stance position comes next. The figure 4 position, align column slightly Forward lean at the ankle, again with the knee bent, elbows back, align ear, shoulder, hip, and ankle. The next part of the running gait is crucial. Toe glute push off. So based on your intensity run that you're doing, your mass, how much you need to push off the ground. With a slight forward lean so we don't jump, pop off the ground in more vertical oscillation. But we must have adequate mobility in our hips and toe to provide this. After pushing off the ground, we are going to into that float or hover stage and to make preparation for landing. This is the distance covered for 1 foot strike when toe glute push off to contact. The distance covered, not the leg reaching out to the next step. A little information on running shoes, and what we want to look for into the running shoe is the characteristics of the running shoe. Here you'll see a more traditional type running shoe. A couple things to take note is going to be the stack height, the drop of the running shoe. From the heel to the forefoot, the difference between that is considered the drop. In this shoe, you'll see a 10+ millimeter drop. When we have a high elevation of heel to forefoot, this puts more stress and more deviation upper spine. We have shortened Achilles, foot muscles, and then consider weakness within the calf and the Achilles to soleus. We want to have a lengthening aspect in the calf, soleus, and Achilles region. Having a more level or neutral shoe with minimal drop, but keep in mind we need to gradually adapt to a lower drop. We can't go from a 10+ drop to a 0 minimalist type shoe without adapting time in that shoe, adapting our intensity, our pace, our distance covered. Second characteristic is it needs to be light, flexible movement. Allow the toes to splay or spread. Upon contact to the ground, there is splay within the toes. When leaving the ground, we need mobility in the toes to push off. You'll see it in the middle picture there, 3 different foot. You can see the first one, the widest between the pinky and the big toe. In diagram A versus diagram C, more of a hallux, bravix, the big toe is all the way over into the other side there. There's no space within the toes. That's utilizing a shoe that has a tight toe box. We want to have a wider toe box, and it needs to flex and move the shoe. Do not be in a shoe coffin where the foot cannot naturally function appropriately. Keep in mind the higher the stack height or the more EVA foam in the shoe, the less proprioceptive feedback we get from foot contact to the ground, to the brain, to adjust how hard we're hitting the ground. All right, so we're going to go through some PTL training fitness principles next. And these training fitness components or principles is what we're going to utilize within our physical training sessions. As we know, we need to have some muscular strength and endurance. Okay, this is some unilateral balance and coordination. We need to have some power and agility. There is some progression to these components as well. For our cardiorespiratory aerobic endurance, we need stamina. We need the capacity to do work, also the speed. Do we have muscle mobility, joint flexibility? And the ratio between Fat-free mass and fat mass is our body composition. The FIT acronym, frequency, intensity, type, time, and type, is what we utilize to break down each one of those components there into how many sessions per week are we doing? What's the level of difficulty? How hard is the exercise? What is the duration? Maybe we need to adjust intensity based on time. And what's the modality of our exercise? And this could be for cardio, strength, and or flexibility, mobility. So 7 training principles, and there's many principles in exercise science, and these are the ones that we utilize most in building and progressing in an exercise program. The first one is the overload. We need to challenge the energy systems. We challenge our load, capacity, volume. Do more than we normally accustomed to doing. Specificity. We know our testable exercises of the push-ups, the sit-ups, and running. We can add specificity of those exercises and or those muscle groups utilized within those exercises, testing exercises as well. Progression. For improvements to occur safe and injury-free, initial fitness level load intensity equal to the individual where they're currently at. So as we add the overload principle into progression there, and that step-by-step fashion there, individual can improve and hopefully decrease injury risk. Regularity or reversibility principle. If we don't use it, we lose it, right? It still kind of works on this. Fitness maintenance can only correct exercise perform on a regular basis. So we need to be consistent with our exercise habits there, adding slight progression over the months and years. Because as we age, an initial fitness level, the amount of reduction of exercise will go down, so will our fitness level. Variation. Enable continuous adaptations to occur over a training period and also help prevent injury. The balance principle. Ensuring opposing muscle groups are worked equally. Imbalances affect performance, also possible injury risk. Single modes of exercise, ignoring muscles, energy systems that should be exercised. For example, if we're working our core, we're not just doing abdominal modified crunch exercises. We got to make sure we're adding exercise for lower back, glutes, and the whole torso region. Different exercises to enhance the specificity of the sit-up. All right, so workout components. So within our fitness principles, we have what's called PAR. Getting ready for exercise, preparing that, the activity itself, and then we need to think about recovery. So what is in the preparation? This is going to be our 10 to 15 minute dynamic warm-up or movement flow. We are not going to statically stretch in this warm-up. We're increasing core body temperature and muscles ready for the demand of the workout. And then we have our activity. Sandwich in between that warm-up and cool-down is going to be our cardio and or strength activities. Recovery can have 2 phases. If we just got done with a 30-minute run, we need to progress to a slower intensity run and or walk in that passive cool down before going into stretching, flexibility, mobility, foam rolling type activities. Air Force has what's called a Mission Fit app. It's free, it's available, download, which has great instructional videos, pictures, descriptions, and workouts with and without equipment. So check out, download, and we'll show you a few of these screenshots in the Mission Fit app. All right, so overview on our physical training. What's great about the Mission Fit app, this will guide your program with tons of exercises and library and workouts. Basic exercise physiology basics needs, hands-on for what could be utilized for a dynamic warm-up, jumping, plyometrics, some strength conditioning, mobility, stretching, even modifications, and when we need to modify certain exercises. So designed for Air Force active duty, periodization of programs developed by some of these SMEs. The exercises designed help hopefully prevent injuries and also progress safely. Technical instructions with the videos. Again, scientifically reason why these exercises are chosen within these conditioning programs. Mechanics, right? The form technique is always important, preventing injuries, but also increasing performance. Here are just examples of some dynamic warm-up. Again, full body movements with drills performed in a progressive, intentional, deliberate sequence from low to some moderate intensity within those 5-10 minutes. Increase blood flow to the muscles, get the nervous system ramped up, muscles through all ranges of motion and planes, ranges and planes of motion. So there's the walking knee hug, hamstring toe touch, side lunge bends. Just some more examples here. Dynamic active warm-up. We'll do more of our movements here in the part 2 of the PTL course. Plyometrics. Plyometrics are just basically a jump, a quick concentric movement. Concentric is the shortening of the muscle during a contraction. So if I'm squatting down, getting ready to jump up on a box, I'm going to have that powerful short concentric and then quickly proceed actively stretching the whole body up and quickly into eccentric there in that stretch shortening cycle. You'll see on the Mission Fit app, it basically goes through basic techniques there from the start position to the finish position. And the progression of each movement is key, how we accurately perform each exercise. Errors are what cause injuries. And when we think about progression to plyometric, we need to balance this out with our strength training types. From coordinational balance to speed explosive power to more endurance. And we mentioned the progressional part of our strength training, functional performance training. Phase 1 is stability strength. Phase 2, endurance. Phase 3, maximal strength. Phase 4, power. You'll see an example there on the left-hand side of the slide of holding one leg balance. Progress to a single leg squat, deadlift, heel calf raise. Progress to resistance. So performing those exercises with a kettlebell, medicine ball, some sort of load or weight. Phase 4, Now we do a single leg squat to jump, the plyometric. The practical part of this will be a workout that will create for a group of 10 people. Your workout should consist of a preparation, an activity, and a recovery. Questions to think about here is, what would your setup look like? What space do you need? Is it going to be in the gym? Is it going to be in the track? Do you need to use equipment at all? What if you had 20 people, 30 people? How would you scale the workout for 3 levels of fitness? The beginner, intermediate, and advanced. Part 2 at the base track. Here are some exercises for core stability. Remember, for great spine hygiene, we want to make sure we're adding some core strengthening and stability exercises within our session. The first one is a front plank. The side plank, the bird dog, and a glute bridge. Modifications, these are the hardest for these exercises. In overall strength training, we want to make sure that we're overloading. Stress on the muscle, also the bone, to do more than normally accustomed to doing. This might be with body weight. This might be with barbell, dumbbells, resistance bands, flipping tires, utilizing arms and legs in more multi-joint exercise fashion. This is where we get the most out of those large muscle groups, and more intensity being utilized. Not just doing one squat, but doing a squat to overhead press is a multi-joint exercise. Versus a leg extension for the quadriceps is a single joint exercise versus utilizing the hip and the knee in a squat, a more multi-joint exercise. Overall conditioning, cardiorespiratory conditioning, but also anaerobic endurance, improving time. To be better at the mile and a half, 1.5 mile run, running more time is not always the case for improvements. We can incorporate different forms of conditioning with time intervals, more of a steady state aerobic base cardio, and maybe some agility running. Modify modes of exercise as needed for injuries or pain. As you see in the Mission Fit app, as different phases and weeks continue on, you always have a warm-up, cool down, and some sort of conditioning program. Here's an example with an agility ladder. Hip mobility and core strength. We know the ramifications of sitting too long, closing down the hips, leading to tightness and lower back pain. Because one of the most neglected areas in active individuals is this core strength and hip mobility. Increasing strength, increasing the mobility in the hip joint, the grittiness in the hip joint, also those muscles surrounding the hip. and the fascial tissue. When our core becomes stronger, it also needs to be able to stabilize our spine and make it stiff, but we can still breathe. Keeps optimal alignment in our posture. Again, remember, core is not just the abs, the lower back, the whole pelvic floor muscles, glutes. Post-workout, we can do some stretching, usually that dynamic movements from in and out of positions in the warm-up, statically holding stretch for time and repeats at the end of a workout. Here are two exercises, one for the crossover IT band stretch and also a more child pose lower back stretch. Here are some more examples of post-workout stretches. Remember, 20 to 60 seconds, 2 to 3 times, go in and out of the stretch, but hold for time for at least 20 seconds. The top calf stretches there, a straight leg and bent knee, some glute piriformis stretch, back, hamstrings, hip flexors, arm and shoulders, the couch stretch, a couple different variations for your stretches. Here are some exercise modifications. In some of these main exercises, you may need to start at the beginning part of this and advance the exercise based on the level of the airman that you're instructing. So from squats, lunges, deadlifts, benching, hang cleans, push presses, push-ups, glute bridge, V-ups, box jumps, bird dogs, burpees, step-ups, supermans, and planks. You'll see some of the progressions in the beginning part with glute bridge lifts, line jumps, bands, utilizing just body weight without adding weight. Modifications increase if you don't have an exercise that you can do. Maybe they need to refrain from doing that exercise at this time and then advance into their intermediate, advanced, and expert progression. Take notice of an exercise not mentioned since you just increase in weight or sets and repetitions. Technique fundamentals. Before any exercise that you're having your airmen do, make sure you can perform that exercise with good technique for demonstration. You may not even be working out, may only be a demonstrator or have another person able to demonstrate if you're not able to perform that exercise and leading that group PT session. You are leading the workout and ensure members are using proper form as best as possible, having spotters around. As your members increase, the more eyes will be needed to watch members doing exercises safely. Utilize assistance with other PTLs to do the workouts to ensure that it runs smoothly. Exercise technique first, intensity last. Some organized group ability type runs. Again, you can always break the groups up based on what their pace might be or based upon their scores of their fitness assessment. Again, recommendations only, adjust as needed based on ability. Here's some additional scale-based organized group sessions. For example, a 3-mile run for time. There might be more run walk within a 2-mile run, 2.5-mile run for intermediate, and then running the full 3 miles for advanced. Circuit training is a good way for time efficiency to get both cardio and strength training activities in a workout session. Here's a list of exercises in this progression, some upper body, maybe some lower body, core, cardio movements. 1 to 5 sets. You can repeat these rounds 20-90 seconds per exercise with rest recovery as needed in between each exercise or each round and set. You could just do strength training exercises, add in running or other cardio plyometric activities for more intensity. Here's our cardio performance training. Phase 1, individuals to achieve a more 30-minute continuous heart rate with base training, utilizing intensity of 180 minus age, or talk test, carry on a conversation. Phase 2 is going to be that intensity with levels of intervals, more of a circuit training modality, plyometrics, jumps, power movements. Phase 3, and then sprints is our phase 4, with multiple minute rest in between each sprint for that workout session. Here are 3 examples for lower body, upper body, and core, that progression for stability, strength, and power. Within our cardio-based training, as that example that we did earlier there, utilizing heart rate, talk test within this progression to be in a more of a healthy running versus overtraining by running too hard, too fast, and just not ready for that demand. Overtraining sets in, where base diminishes, performance, injury, and health will suffer. 80% of a run should be in that 75% intensity level. We can breathe, conversational pace, intensity 180 minus age. That's your cruising speed, heart rate. Approximately 30 minutes for that aerobic base time for 1.5-mile improvements. Also utilizing the more perceived exertion training scale, 75 to 90%. 75% is 11 to 12, 90% gets closer to 16 and 17 on this number scale. Here is more of a time-based week 1 to week 10 walk to run to get you to running 30 minutes continuous by week 10. Here's another 9-week running progression. Here we have certain days off that we are not running. Walk to run for 1.5, another 6-week program. And some tips to better your 1.5-mile run test. Vary run conditioning drills. Again, we mentioned endurance, which is your aerobic-based training. Once every 7 to 10 days, adding sprints in, pace, or some tempo runs, which is setting like a 30-minute run or doing a 5K at a certain percent intensity, once or twice a week. Cross-train with elliptical, stairs, other modality besides running. Certain weeks out, do a mock practice test. Adding always breathing, relax. Don't ramping yourself up into more of a fright flight, increasing more anxiety for your fitness assessment. Get outside as much as possible. Utilize only as needed based on weather conditions for indoor treadmill training. If treadmill is utilized, increase grade to 2 to 3%. All right, we're going to cover a few readiness through injury prevention information. One of the key injury issues to arthritic readiness, of course, is musculoskeletal type injuries. Number one is our lower back pain. Most leading cause for lost duty days in the Air Force. Again, as PTL, we can only control, for the most part, each exercise session. Educating PTL proper conditioning techniques to reduce the risk of injury for airmen during sports training. Multifaceted, a lot of injury variables here that can cause, if it's going to be that joint pain, knee pain, back pain, plantar fasciitis, shin splints. It all breaks down to too much, too soon, too fast. Are we not moving well with poor mobility and not able to stabilize a joint? Sitting too much, not moving well in gait, overtraining, poor nutrition, imbalances, poor technique, and lost strength and weakness. Strong foundation is key, but keep in mind individual lifestyle factors. Our sleep, tobacco, alcohol use, how are we feeling the body? Are we walking? And our progression here in posture positions, our mobility, core stability, strength endurance, aerobic base, soft tissue, foam rolling, and static stretching. Injury threshold, pain at the top. So with lower back pain, we need to address what is the frequency, time, intensity, the volume, the load. Are we sedentary, not moving at all? The mantra of too much, too soon, too fast. How well are we moving within our quality, not just quantity of exercise, movement patterns and mechanics and postures and sitting and ergonomics. Our core muscular strength foundation from our feet to our neck. Tissue tolerance, that's our fascial tissue there. Do we have the lengthening capacity, or is it gritty like beef jerky? Too much weight for our frame of not muscle mass, but more or less body fat. Previous injuries, imbalances, and then poor joint mobility, movement, not able to stabilize, and poor motor control. Highlighting here is back pain. This is our highest, number one diagnosed orthopedic condition. Again, very multifaceted within our lifestyle, but poor posture positions and poor mechanics and movements, not sleeping well, high sugary diet, poor blood flow with tobacco use, overall oxidative inflammational stress, or repetitive stress within movement, poor movement patterns, high elevated heel and footwear, creating this adaptive shortening, soft tissue, exoskeleton issues within our muscle mobility. Poor core, not able to stabilize the spine. Stress transfer to ligaments. Meat just hanging off the bones. Compressional forces with gravity and sitting, especially in this lower back area, creating bulging disc, lumbar and cervical neck area. Repetitive, poor use, imbalance of flexion of the spine, loss of neutral, loss, compromise of good posture from ear, neck, looking down at our cell phones multiple hours a day, screens, text neck, head forward on neck position at our computer. As we screen it and assess our load, our volume, our intensity, a few movement screens that we're going to go through in part 2 here, but just want to show this here's what we can look at there, how well are we moving. We need to identify first poor movements in joint and muscle, correctively exercise those areas there for improved capacity of movement, skill transferred into quality and quantity of exercise movement. Adding in myofascial release, some soft tissue work with lacrosse ball and or foam roller is necessary. Spending 10 minutes a day, 2 minutes on a certain area for change. All right, follow us on the Facebooks, 325th MDG-Health Promotion, contact information if you have any questions from this brief. Thank you.